It's 2 in the morning. You wake up needing water, you sit up in bed, and suddenly the whole room tilts, spins, and refuses to hold still. Your stomach drops. Your hands grab for the nightstand. For a few terrifying seconds, you genuinely wonder, is this a stroke? A brain tumor? Something wrong with my heart? Take a breath. For the vast majority of people, none of those things are happening. What's happening is something much smaller, much more common, and this is the important part, often fixable in about 2 minutes, using nothing but your own head and a pillow. In the next 20 minutes, I'm going to walk you through exactly why this spinning sensation happens, how to tell if you're dealing with the most common cause of it, and the exact clinically backed technique that resolves it for most people, step by step, so you can actually use it the next time it happens to you. Before we go further, quick introduction. I'm an ear, nose, and throat surgeon, and over more than a decade in this specialty, I've had hundreds of patients walk into my clinic pale, shaking, absolutely convinced something catastrophic was happening inside their skull. In almost every one of those cases, once we ran the right tests, the actual diagnosis was something small, mechanical, and treatable, a tiny problem in the balance system of the inner ear. I'm not going to fill this video with fear or exaggerated claims. My goal here is simple: give you the same explanation, the same reassurance, and the same practical tool I give my own patients in the exam room, so you can understand what's happening in your body instead of just being scared by it. Let's start with something that sounds like semantics, but genuinely changes how you approach this problem. Dizziness and vertigo get used interchangeably by almost everyone, but medically, they're not the same thing at all. Dizziness is a broad, fuzzy umbrella term. It can mean lightheadedness, feeling faint, feeling foggy, or just a general sense that something is off with your balance. Vertigo is far more specific. It's the false sensation that you or the world around you is spinning, tilting, or moving, even though you are completely still. That distinction matters because true spinning vertigo points to one particular part of the body almost every single time: the inner ear. Here's something most people never learn, even in a basic biology class. Buried deep inside your ear, past the parts responsible for hearing, sits a structure that has nothing to do with sound at all. It's your body's built-in motion sensor. It's made of 3 tiny, fluid-filled loops called the semicircular canals, arranged at right angles to one another, almost like a miniature 3D gyroscope built entirely out of biology. Every time you turn your head, nod, or tilt sideways, fluid inside those loops shifts, and microscopic hair cells lining the canals detect that movement and send a constant stream of signals to your brain about exactly how your head is oriented in space, all day, every day, without you ever noticing it. Think of it like a carpenter's spirit level, except instead of one bubble telling you if something is flat, you have 3 separate levels, each one monitoring a different plane of motion, working together in real time. Most of your life, this system runs silently in the background. You only become aware of it the moment something inside goes wrong, and that moment is exactly what we're talking about today. So what actually goes wrong? In the overwhelming majority of sudden short-burst vertigo cases, the answer has a name: BPPV, which stands for Benign Paroxysmal Positional Vertigo. It sounds like a mouthful, but honestly, the name itself tells you almost everything you need to know if you break it apart. Benign means it is not dangerous, not life-threatening, and not a sign of something growing or degenerating in your brain. Paroxysmal means it arrives in sudden, short attacks rather than as constant, ongoing dizziness. Positional means it's triggered specifically by changing the position of your head. Put those together, and you get exactly what it is: a harmless condition that produces brief spinning episodes whenever you move your head a certain way. Here's what's physically happening inside your ear when this occurs. In one part of your inner ear, there's a small patch containing microscopic calcium crystals. Doctors call them otoconia, but I'll just call them crystals for simplicity. Normally, these crystals sit exactly where they belong and help you sense gravity and straight-line movement, like when an elevator starts moving. But due to aging, a minor bump on the head prolonged bed rest, or sometimes for no identifiable reason at all, these crystals can come loose from their normal spot and drift into one of the three fluid-filled canals we just described. Once they're floating around in there, they don't belong, and they cause chaos. Every single time you move your head afterward, rolling over in bed at night, reaching up to grab something off a high shelf, tipping your head back in the shower to rinse your hair, those displaced crystals shift inside the fluid and send your brain false, exaggerated signals about motion that isn't actually happening. Your eyes are telling your brain you're perfectly still. Your inner ear is insisting you're spinning through space. That mismatch between two conflicting signals is precisely what you experience as vertigo. I want to give you a sense of just how common and how indiscriminate this is. I've treated patients in their 60s and 70s who suddenly couldn't roll over in bed without the entire room lurching sideways. I've also treated a patient in her early 30s, an active yoga instructor, whose very first episode hit during an inversion pose in class. Age, fitness level, general health, none of that predicts who gets it. If those crystals happen to drift into the wrong canal, the symptoms look almost identical no matter who you are. Now I want to be completely honest with you here, because a technique that resolves symptoms in about 2 minutes can sound almost too good to be true, and I don't want to oversell it or set you up for disappointment. BPPV is, by a wide margin, the single most common cause of sudden vertigo, but it is absolutely not the only possible cause, and it's important you know the difference. Vestibular neuritis or labyrinthitis involves inflammation of the inner ear, often following a viral infection, and it tends to cause more constant, longer-lasting dizziness that can last for days, rather than the short, movement-triggered bursts we're focused on today. Meniere's disease is a different inner ear condition that combines vertigo with ringing in the ears, a feeling of fullness, and fluctuating hearing loss symptoms BPPV simply does not produce. Vestibular migraine can cause episodes of dizziness that sometimes occur with a headache and sometimes without one at all, which makes it easy to confuse with other causes. And in plenty of cases, the root cause isn't the inner ear at all. It can be low blood pressure when standing up too quickly, simple dehydration, a side effect from a medication you're already taking, or even an uncorrected vision problem quietly throwing off your sense of balance. I'm walking you through all of this so you can use everything in this video intelligently, not blindly. The technique I'm about to demonstrate was designed specifically for BPPV. It will not meaningfully help these other conditions, and that's exactly why the next section, figuring out what you're actually dealing with, matters just as much as the technique itself. So, before you try anything physical, how do you actually know whether what you're experiencing is BPPV specifically? There are 3 key signs, and I want you to pay close attention to these, because they're genuinely the difference between this is safe to try at home and you need to call your doctor first. Sign number 1, the spinning is brief. Classic BPPV attacks typically last under a minute, often just a handful of seconds. Even though in the moment, with your world spinning, it can feel like it drags on much longer. Sign number 2, it's triggered by a very specific head movement. Rolling over in bed, looking up toward a high shelf, bending down to tie your shoes. The spinning starts almost immediately with that motion and then fades again once you hold still. Sign number 3, there's no accompanying hearing loss, no ringing in your ears, no slurred speech, and no other neurological symptoms riding along with it. It's purely a spinning sensation tied to movement, nothing more. If everything you just heard sounds exactly like your own experience, then what I'm about to demonstrate next was designed precisely for this scenario. But if your episodes last much longer, come with hearing changes, or simply don't fade once you're still, stay with me. Because a little later in this video, I'll walk through exactly when you should skip the home technique and go straight to a doctor instead. This is the modified Epley maneuver, and it's the single most studied, most clinically validated technique available for repositioning those displaced crystals back where they belong. Clinical research shows roughly 80 to 90% of people experience meaningful improvement after just 1 or 2 rounds of this maneuver. Let's walk through it together, slowly, one step at a time, so you can actually follow along the next time you need it. One quick but important disclaimer before we begin. If you have existing neck or back problems, if you're pregnant, if you're elderly with a meaningful risk of falling, or if you're genuinely unsure which ear is causing your symptoms, please talk to your doctor or a physical therapist before attempting this on your own. Step 1. Sit upright on your bed with your legs extended out in front of you. Turn your head 45 degrees toward the side that tends to trigger your dizziness. Think of it as your problem ear. Step 2. Keeping your head turned at that same angle, lie back quickly but in a controlled way so that your head ends up hanging slightly off the edge of the bed, still turned at that 45-degree angle. This exact moment is usually when the spinning kicks in, and I want to be clear, that's expected. It's actually a sign that you're doing the maneuver correctly, not a sign that something's wrong. Hold this position for 30 seconds or until the spinning fully stops, and then hold for an additional 30 seconds after that just to be safe. Step 3. Without lifting your head off the bed, turn it 90 degrees toward the opposite side so you're now looking in the completely opposite direction. Hold this new position for 30 seconds. Step 4. Turn your head and your entire body another 90 degrees in that same direction so that you end up nearly facing down into the mattress. Hold this position for another 30 seconds. Step 5. Slowly and carefully bring yourself back up into a sitting position, keeping every movement controlled and unhurried rather than sudden. That entire sequence takes roughly 2 minutes from start to finish. Many people notice significant, immediate relief after just a single pass through these steps. If you try it once or twice and notice absolutely no change, resist the urge to keep repeating it over and over, hoping for a different outcome. At that point, it's time to get an in-person evaluation from a professional instead. Let's talk clearly about when this is not something to handle on your own. Stop immediately and seek urgent medical attention if your dizziness arrives together with a sudden, severe headache, unlike anything you've felt before, slurred speech, sudden weakness or numbness on one side of your body, double vision, new and severe difficulty walking, or any loss of consciousness. Those symptoms are warning signs of something far more serious than an inner ear problem, potentially a neurological emergency, and they call for immediate medical care, not a home maneuver. I also want to be direct about who should not attempt this technique without guidance. Please don't try this alone if you have significant neck or spine issues, if you are currently pregnant, or if you're older and carry a genuine risk of falling. In any of those situations, a physical therapist can walk you through a safer, properly supported version of this same technique. And to be completely clear, this video is educational content designed to help you understand your own body. It is not a replacement for an actual, in-person medical evaluation from your own doctor. Let's bring everything together. Dizziness and vertigo are not the same experience, even though we tend to use the words interchangeably. The single most common cause behind sudden spinning attacks is BPPV, tiny displaced crystals drifting into the wrong part of your inner ear and confusing your brain's sense of motion. And for most people dealing with exactly that, the modified Epley maneuver can reposition those crystals in roughly 2 minutes, right at home. If you want to lower your odds of a repeat episode going forward, here are a few simple habits worth adopting. Get up out of bed slowly in the morning rather than jumping straight up. Avoid unnecessary extreme head-tilting back positions when you don't need them. And if you've experienced BPPV once already, learn to recognize the early signs so you can respond to it quickly the next time it shows up. If this video actually helped you understand what's happening inside your own head, go ahead and subscribe and tell me in the comments which specific movement or which ear tends to trigger yours. It genuinely helps me choose which topics to cover next. In our next video, we're breaking down the 4 most common reasons people develop ringing in their ears and which remedies are actually worth trying.